Difficulties. My name is Gabby, and I'm the librarian at the Addison Public Library. And I have with me Scott and Ashley from Hamdard Healthcare. Did you guys want to briefly go over what you do at Hamdard?
Sure. So my name is Ashley. I'm a nurse practitioner at Hamdard Healthcare Center in Addison, Illinois, and I am a family nurse practitioner. So I see all ages at our clinic, 0 to 99.
Yeah, and my name is Scott, and I'm the health educator over at Hamdard. And along with offering health education, we do also offer health navigation. So if you know anyone that does need assistance with applying for benefits, you definitely know where to find us. And then we lastly have a behavioral health department. So we do have counselors for all ages.
Wonderful. Thank you so much. So since we're live, feel free to drop any questions, comments in the comment section. We'll be monitoring those. We're going to have a brief presentation over COVID, just summarizing what's been going on and also talking about the vaccine. And then we'll go back to the questions at the end. Okay, thank you.
All right, everyone. So again, my name is Ashley, and I'm the nurse practitioner at Hamdard Healthcare Center. So welcome to our COVID-19 vaccine information. And again, if you have any questions, just feel free to type in a comment, and we'll try to get back to you as quickly as possible and get answers for you. So here we go. Okay, so COVID-19 and the basics. So what is known about COVID-19? Infection with the SARS-CoV-2, the virus that causes COVID-19, can result in a range of illnesses from mild symptoms to severe illness, as well as death. We do not know how the SARS-CoV-2 will affect each person. Some people, such as adults 65 and older, or people with certain medical conditions, such as diabetes, high cholesterol, hypertension, or high blood pressure, or people that are immunocompromised, such as people unfortunately affected with cancer, are more likely than others to become severely ill from COVID-19. So how do we prevent COVID-19? There are very many ways to do so. The most important one is to wear a mask that covers both your mouth and your nose at all times. Avoid close contact with others. We want you to stay at least 6 feet away from others, which is about 2 arm lengths from other people. We do also advise that you avoid crowds and anywhere that has a poorly ventilated space. We always would advise you to wash your hands with soap and water. We always prefer soap and water over hand sanitizer if it is accessible to you. Otherwise, we do advise the use of that alcohol-based sanitizer with at least 60% alcohol in it if that soap and water is not available. It is also important to note, we also want you to avoid touching your eyes and touching your mouth with unwashed hands. We also want you to clean and disinfect frequently touched surfaces, and we also advise you to get the COVID-19 vaccine. So COVID-19 vaccination is a safer way to build protection against COVID-19. Getting the virus that causes COVID-19 may offer some natural protection, of course, that is known as an antibody or immune, but experts do not know how long this natural protection lasts. The risk of severe illness and death from COVID-19 outweighs any benefits of natural immunity. COVID-19 vaccine helps protect you by building your own immunity without the risk of severe illness and of death. So here are some key facts about the vaccination for COVID-19. Getting vaccinated will, of course, help prevent getting sick with COVID-19. It is known that people who have already gotten sick with COVID-19 may still benefit from getting vaccinated. COVID-19 vaccines cannot give you COVID-19. So we just want to make that clear with everyone, as that's really, really important to clarify at this point. And COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. It may cause you to test positive on an antibody test, though. So we do want to clarify that with you as well. So the safety of the COVID-19 vaccine is a 100% top priority, and we are being very, very safe with this vaccine. The COVID-19 vaccines are being held to the same safety standards as all other vaccines, which is very important to note. Before the authorization of the COVID-19 vaccine, the FDA carefully reviewed all safety data from all their clinical trials. The ACIP reviews all safety data before recommending any use of a vaccine. After authorization of the vaccine, the FDA and the CDC closely monitor the vaccine safeties as well as the side effects that are affected by this vaccine in all people. There are systems in place that allow the CDC as well as the FDA to watch for these safety issues. And this system is called the VAERS system, or the Vaccine Adverse Event Reporting System. And that is on cdc.gov. So with getting a COVID vaccine, it just helps to create an immunity response in your body against the virus. It also may help you from getting severely ill, even if you do get COVID-19. So let's discuss the vaccines that have FDA approval for emergency use. 3 vaccinations have received FDA emergency use authorizations. Now, actually, that happens to be 4, not 3. The first one is the Pfizer vaccine. It is known that it is 95% effective, and that is based on the manufacturer's data. The second one is the Moderna vaccination. That is 94.5% effective. And the Johnson & Johnson vaccine that was just FDA approved most recently has been shown so far to provide 85% effectiveness, and that is with 1 dose of that vaccine. There is a 4th one, which is the AstraZeneca, but that one is still pending approval by the FDA at this point in time. So with the Pfizer and the Moderna vaccinations, both are mRNA vaccines, and they follow a 2-dose schedule. So people should be vaccinated and complete the 2-dose series with that same vaccine product, and that's very important to note. So if you start your vaccination series with Pfizer, you want to have that 2nd dose with Pfizer only and not interchange it with the Moderna and vice versa. If we do that, then it's not going to be as effective in preventing the COVID-19. So what do we expect? What do we expect before vaccination? We want you to learn about the COVID-19 vaccines, and we want to see if the COVID-19 vaccination is recommended for you. During the vaccination, we want you to read the fact sheets that we give you that tell you about the specific COVID-19 vaccine that you're receiving. We also want you to receive a vaccination record card just so that you have it. And we can also update your medical chart now and in the future to reflect that vaccination. After vaccination, we expect that you might have some side effects. It is important to note that not all people have side effects to the COVID-19 vaccines, but a lot of people may experience those COVID-19 side effects. This vaccine affects everyone differently, just like any other vaccine would. Some people will have no symptoms or mild symptoms, and other people might have more moderate symptoms, such as a fever, which may be expected. But usually that will go away usually in just a few days, and that is a normal side effect of this vaccine. So that's very important to know. So the COVID-19 vaccine Illinois priority tiers. So in the state of Illinois, we have several different tiers. Phase 1A of the COVID vaccine tiers say that long-term care residents are first priority for the COVID-19 vaccination. So that includes long-term care facility staff members and other congregate care, as well as healthcare personnel. So if you work in the hospital or non-hospital settings as a healthcare worker, a long-term care healthcare facility or other conjugate care, that is the first people to get vaccinated. They receive that preference. The second phase is phase 1B. And phase 1B is currently where we are at this point in the process of COVID-19 vaccination. So this includes people who are age 65 and above, and this also includes frontline essential workers. This includes first responders, any corrections officers or inmates, any food or agricultural care workers, any postal service workers, manufacturing workers, grocery store workers, public transit workers, anybody in education, as well as shelters and adult daycare. Okay. Phase 1C, which is yet to commence, will include anybody age 16 to 64 with medical conditions that increase the risk for severe COVID-19. And a lot of these people in this category are actually already getting vaccinated as well. So we're just starting to do that though. So other essential workers may include transportation and logistics workers, people who are in food service, any housing professionals or finance professionals such as bank tellers or bank personnel, any information technology and communication workers, anybody who works in energy or the media, or legal workers, or public safety workers, such as safety engineers, any water and waste workers, and any public health workers. Like we just discussed, it is possible that phase 2 will include the rest of the population age 16 and up. We're just not at that phase yet. So there will be more to hear on that soon. So vaccination is the #1 measure to help stop the pandemic. While COVID-19 mRNA vaccines appear to be highly effective, additional preventative tools remain important to limit the spread of COVID-19 at this time. So the combination of getting vaccinated and following CDC recommendations to help protect yourself and others offers the best protection from COVID-19. We want you, again, to cover your nose and mouth with a mask. We want you to stay that 6 feet away from others who don't live with you, and to avoid crowds in poorly ventilated areas, as well as washing your hands. Okay, so this slide will discuss how we protect ourselves, our family, our community, our coworkers, this is just the best way is by getting vaccinated. So we want you to choose to get vaccinated when it's offered to provide the best protection against COVID-19. We want you to participate in VSafe, which is that vaccine adverse event reporting system after you do receive the vaccine. And this will help the CDC monitor for any health effects after vaccination. And we want you to share your experiences with coworkers, family, and friends to let them know. We also want you to know the basics about that COVID-19 vaccine, and we are here to help answer questions from you as well as your friends and your family. And we also want you to show that you received the vaccine by wearing a sticker or a button prominently. Okay, so the CDC COVID-19 vaccine websites, so you just go to www.cdc.gov, and then you put /vaccines/COVID-19, and then index HTML, and we will have those posted for you, and recording this live stream event. That way you have the resources available to you. That will be available. Okay, so the frequent concerns that we get about COVID-19 vaccines that I do want to address, people are concerned that vaccines were developed too quickly to be safe, and that is not true. Another concern is I do not want to be a guinea pig for these vaccinations. Another one is the vaccines will give you COVID-19, which is not true. The vaccines use experimental technology that rewrites your DNA, and also that the side effects from these vaccines are worse than COVID-19, actually getting COVID-19, which is not true. Okay, so again, just discussing getting vaccinated. So where and when to get your vaccine. So COVID-19 vaccines are currently offered at our healthcare center. It's called Hamdard Healthcare Center again. It is by appointment only. We do have 2 clinics, so it's important to note that as of right now, the clinic that is available for COVID-19 vaccination is our Chicago clinic only. Right now, Addison Clinic is not accepting appointments for COVID-19. However, our Chicago location absolutely is, and we encourage you to use our location. Our address is 1542 West Devon Avenue in Chicago, Illinois, 60660. And we are currently offering the vaccinations on weekdays, Monday through Friday, and currently between the hours of 10 and noon. So at this time, we would appreciate the community to sign up for the COVID-19 reservation vaccination list. And we do have this posted in our presentation. So it's www.hamdardcenter.org/COVID-19 waiting. And we will reach out to you personally by phone from the clinic once vaccines are available. And once we can have you come into the clinic, okay? And then there's also additional COVID-19 vaccine registration links that you can go to besides Hamdard in your local community, and that is DuPage County. So that's www.dupagehealth.org. And then you want to type in /667/COVID-19 vaccine. And the other link is for Cook County residents. And that web address is www.vaccine.cookcountyillinois.gov. Okay, so again, just reiterating, after the vaccination, we do want you to continue COVID-19 prevention measures. So we do want you to cover your nose with a mask and cover your mouth as well with a mask. We want you to stay at least 6 feet away from people who do not live with you. Avoid crowds and poorly ventilated spaces. Wash your hands with soap and water. And if that is not available to you, use that alcohol-based sanitizer. 60% alcohol or more is what's recommended. And to also clean and disinfect frequently touched surfaces. We also want you to enroll in that VSafe vaccine adverse event reporting system as well, to make Illinois aware that you received this vaccination, okay? And if you have any questions regarding the vaccine or about your health status before, during, or after vaccination, we will always encourage you to call your doctor or your nurse or your local healthcare clinic at any time. Okay, so now we're going to open up the presentation to any questions. Okay.
So if you're just tuning in, this presentation will be available after we're done. But feel free to drop any questions. Si hay alguien viendo en español, yo también puedo leer en español, así que la pueden dejar y yo hago la pregunta en inglés. A ver. Looks like we have a question. For those who are not tech savvy, is there a phone number for vaccine registration?
There is. You can just call our local Hamdard Healthcare Center Chicago location for registering for the vaccine. We'd be more than happy to help you register for that registration vaccination reservation list at our Chicago location.
So I just posted the phone number for the Hamdard Chicago location. While we wait for more questions to come in, I will read aloud some that were submitted anonymously. We included a form in our newsletter so that anyone could submit questions. So let's see. Um, so if we happen to get the vaccine, would we still be able to transmit it to someone else?
So it is possible to do so. You are not 100% safe by getting the vaccine. The vaccine just helps you to prevent getting COVID-19. So it is possible. However, it is rare. But we do not want to tell you that no, it is not possible. So that's why it's really, really safe even after you receive the vaccination to keep protected and wear your mask and have it cover your nose and your mouth and stay that 6 feet distance away and really just continue to protect yourself and your families.
Okay. And then there's a question about participating in VSafe. So it's recommended, you get your vaccine, you sign up so you can report any side effects, any symptoms. Is there a penalty for not participating in VSafe?
There is not a penalty for not participating in VSafe for the general population. Absolutely not. We just absolutely recommend you to do so. That way, there's more reporting of potential side effects and adverse events from this vaccine. That way, we can continue to keep everybody in our local community and our state safe.
Awesome, thank you. So there was a question about the efficacy rates. If it says that it's a 95% efficacy, which is, I believe, for the Pfizer one, what does that mean? Does that mean
it is 98% effective at preventing COVID-19? That is what that means. And that is based on the manufacturer's data and based on the evidence of the clinical trials of all of the people who were vaccinated during those clinical trials. So that is what they determined as that percentage rate of that vaccine being fully effective against getting COVID-19 with that vaccination, having that vaccination.
So if we had 100 people, maybe 5 of them would not be resistant to it. Okay.
Yes, absolutely. Yes. Yes.
And then once we get the vaccine, would it be safe for us to travel on an airplane?
Yes, but not only with one dose. You always want to make sure, unless if it's the Johnson & Johnson vaccine, which is that one dose series, with the Moderna or the Pfizer, you do want to make sure that you have both doses of that vaccine to be more so fully protected and lessen your risk of contracting COVID-19 at that time. So we would always recommend that you complete that 2-dose series for the Moderna as well as the Pfizer before traveling.
So you did mention getting both the doses in the series. If you were only to get one, are you slightly protected? Is it just not effective if you get one out of the 2?
The vaccine is still effective. It's just not fully effective. So the determination of how effective it is after one vaccine dose, we don't know that rate. It's not well known for that. So I don't want to put out information that we don't know. But after getting one dose of the vaccine, you definitely are more protected against COVID-19 than not getting the vaccine at all. So we always recommend, getting the vaccine, and completing that 2-dose series. But for some reason, if you're not able to, or if you can't tolerate that first dose of the vaccine, you are still protected. It's just not well known how much.
Let's see. Is it okay to get the vaccine if I'm taking other medications?
That would depend on what medications you're taking, and when you go for your vaccination, you'd want to discuss that with your healthcare provider because that would be based on an individualized basis. But for instance, most people who are immunosuppressed, like I had talked about, people who have cancer, in particular, who are immunosuppressed or receiving chemotherapy or radiation, would still be benefited by receiving this vaccine.
And then we had multiple questions about like our older family members. Just if we were to get like both vaccines, would we be able to hang out with our parents, our older parents, our grandparents, and like indoors, and for it to be safe? Should we wear a mask? Should we not wear a mask?
Sure.
Should we get like a test after we get the vaccine to check? Just what's recommended as far as visiting older family members, especially when you think about like grandchildren who want to visit their grandparents.
Absolutely. Yeah. So the current recommendation with that is if you're vaccinated and you're fully vaccinated, you are protected, but again, we don't, you can still get COVID-19 even if you're vaccinated. So again, you are, more than welcome to go visit grandparents. However, we want you to always wear your mask. To protect them. So we would still advise you to keep that 6 feet social distance and to still wear, your mask that covers your nose and your mouth at all times to protect them, even though you're fully vaccinated. And it's also very important that they get their vaccination. And since they are part of that first tier in Illinois, anybody 65 years and up is a part of that first tier. So it would be very beneficial, and I would care to say faster for them to receive it than for any other population at this point in time in Illinois to get that COVID-19 vaccine. So them in particular, we would want to give the COVID vaccine as soon as it's available to them.
Let's see. Has there been any more like news or reports about getting vaccines for children yet? Since it's still not obviously approved for children, what else can we do to like protect them, or how long do we foresee the wait to be? There's no good answer for that question. It is a very, very good question at this point, and we still do not have an answer on when that's going to be available to children. As soon as we do have more information on that, we will let you know. But at this point, there really isn't a general consensus guideline, at least as far as I'm aware, about when it will be available to children. I think it is based on a case-by-case basis. But definitely, as soon as we have an updated guideline, we will let you know. At this point, the safest thing to do to protect your children is to get vaccinated yourself, if you're able to at this point in time. And if you are not able to at this point in time, just because of the phasing and the tiers, really just being vigilant about following those safety guidelines in preventing COVID-19. Okay. Let's see. So it wasn't asked this time around, but it was asked for our Spanish session a couple weeks ago. How long is the immunity for once you get the shot? Because we know, like, we've heard that when you get COVID, you have like immunity for some time. You see the antigens in your body.
Right.
So how long would the immunity be once you get the vaccine?
That is still a question that does not have an answer. We do not know how long you're going to be immune from COVID-19 even after the vaccination. And so since we don't know that answer yet, just trying to stay very vigilant and trying to protect yourself as much as possible. I wish I did have an answer for that question. That would be great to know. But at this point, there really isn't a solid answer to that question.
Okay. We've got one from Facebook. When will library staff get the vaccine? Promise it wasn't me.
I believe, can we go back in reference to that, that phasing slide, please, Scott? I believe it would be phase 1B, I believe. Let's see. So if library staff was considered educational workers, that would be phase 1B, which I believe that it would be considered an educational worker. You know, phase 1B again is in swing right now. We are definitely, just because of the shortage of vaccines available right now in the state, we are still prioritizing people age 65 and older. But I know there are other places such as CVS and Walgreens and other places that might have more vaccines available to them than your local health centers and your private healthcare centers. So they might be able to vaccinate you now. But I know for Hamdard in particular, at least at this point, just because of availability of vaccine, I know for our healthcare center specifically, we are prioritizing people ages 65 and older at this time.
Yeah, just based on my experience and my understanding, we don't necessarily qualify under 1B. We haven't been deemed necessarily educational professionals. You know, the library, there's a lot of educational aspects in there, but they're saving that more for like teachers and like school staff. So maybe 1C. I know the Library Association was pushing to get us vaccinated just because of our role with the community, and we've got people of all ages and all walks of life coming into the library. So we're still waiting to hear what phase we necessarily fall in. And they need a letter from the company. So there is another question about needing a letter from the company. Do you guys provide letters when people get vaccinations at Hamdard, the clinic?
So we actually give you a vaccine record card that shows the dates as well as all of the information about that vaccine on our vaccination card. So we will actually get that to you instead of a printout of receiving that vaccine. Currently, if you were to ask for one and you would like one, we would absolutely provide that to you. If you would like a printout of that vaccination, we are more than welcome and willing to do so. But at this time, usually we just give you the card that says the first date of that vaccination, because at Hamdard, we provide the Moderna vaccination. So that's that 2-dose series. So you'll see on our card that first dose and then also that second dose. And we ask you to bring that card back to us at that second visit so we can fill that out for you and make sure that it's complete.
Speaking of the Moderna, have you heard anything? I mean, it's more anecdotal, I guess, between which one has worse side effects. I know people have been mentioned like the soreness and just like the tiredness. But I've also heard that like that second shot, it can be a little rougher for like the first like 30 hours.
Absolutely. And that is true. So for the Pfizer and the Moderna, there is not one vaccination that is more efficacious than the other, or one that will give you more side effects than the other. That just has not been proven. It really, your response to the vaccine is individualized to you. There's, like I had mentioned before earlier in the cast, some people will have absolutely no symptoms whatsoever and feel perfectly fine. Others might have mild symptoms like nasal congestion or some fatigue or some injection site soreness or irritation or swelling even. Some people, even like myself, who just completed my series, will have more severe symptoms such as high fever for a few days. and with diaphoresis, which is sweating due to the fever. You can have some chills as well due to the vaccination. So it really just depends on your body's natural immune response and how your body responds to the vaccine. But in regards to Pfizer versus COVID and side effects and which one is better or worse, that has not been proven. That one is more preferred versus the other in regards to side effects.
Okay. I just got a message about President Biden directing states to make all adults eligible for COVID vaccine by May 1st. Do you think there's enough vaccines available in the coming weeks to make this happen?
So I don't want to answer that question because I'm not well informed about that. I know that the state is working very, very hard at trying to fulfill that order and that mandate. All of our, local community organizations are working with the local health departments and with the state to make sure that we can receive as much of that vaccine as possible at this point. However, do I know if how much is actually available at this current time? I do not. But I am hoping that we will be able to meet that goal.
Yeah, here's the hoping. I know, like myself, just jumping back to the library staff getting the vaccine, just because we've heard what a hard time seniors are having to get the vaccine. I'm also just trying to hold back and not push the whole case for me getting it ASAP, just because they're more at risk, and we know they need to go out and get groceries and stuff, so we can't just say, hey, stay inside forever. So ideally we want to make sure a larger portion of that population gets vaccinated before I go and get it.
Mm-hmm. Mm-hmm.
Let's see. If you don't experience any side effects, if you do experience side effects, are there any over-the-counter medications you should not take?
So at this time, you can still alternate Tylenol as well as ibuprofen. So I know that there was a lot of debate against, versus not using ibuprofen or not, and how safe that was with the vaccine. But currently, we are still recommending, use of Tylenol or ibuprofen for that, mild aches and pains. We do prefer Tylenol over ibuprofen for fever. So if you're having a fever, fever is determined, anything that's above 101 is a high fever. So you would want to take Tylenol for that. If you do have a low-grade fever, 99 or above, we would of course suggest, to wait on taking Tylenol. But at the same point, if you're really not feeling good and it's continuing to get worse or not go away, then we would want you to take Tylenol. But there has not been any evidence saying that you cannot or should not take ibuprofen for treating your mild symptoms of side effects.
Okay, and then we've got another one. If you were to get the vaccine and then you start getting symptoms, should they quarantine or should they get retested for COVID? I know fully vaccinated is supposed to be 2 weeks after you get both your doses, or one, depending on which one you get.
Absolutely.
So should there be a retest or something?
Yeah. So at this point, in regards to quarantining after you get symptoms from the vaccine, if they're the typical side effects from the vaccine of that mild, achiness and pain, sort of side effects, we would always, recommend that you, stay in until you feel better, but not necessarily having to quarantine. But definitely, if you're having a fever, are having more severe side effects, we would definitely encourage you to quarantine, but also, as you were saying, to get retested for COVID-19, just because, vaccines can take up to 2 weeks to be fully effective. So during that time, if you were to get exposed to someone with COVID-19 during that time, and develop symptoms, we would, of course, encourage you to get retested for COVID-19. Does that make sense? Okay.
Okay. So let me just double check. Is there any other tips you can provide as far as like where else people can sign up if they're having a hard time getting the vaccine, or they're still like on a really long waiting list, aside from, signing up for the clinic or on the county?
So the other really good resources available is that www.cdc.gov for that vaccination list. But also a really good resource would also be, in addition to your local health department or county health department, would also be to call Illinois Department of Public Health. So if you don't, have any resources available to you at that current time, the Illinois Department of Public Health would be a great resource. But definitely reaching out to your local health department or the county health department is most beneficial at this point. But those are definitely some resources that are available to you. And again, we have the links for DuPage County as well as Cook County vaccine registration links available to you during this podcast.
And then it looks like we've got a question for something, just to reiterate, the longevity of the vaccine.
In regards to efficacy?
Yeah, the immunity for anyone that's tuning in now.
Right. So, we don't know how long you will be protected against COVID-19, even with the full 2-dose series of the vaccination at this point. We just do not know how long you're protected. So we're always encouraging everybody that even though you do have the full dose of that vaccination, to always stay protected and continue to follow the COVID-19 guidelines of staying that 6 feet apart from others, as well as wearing your mask in public or around your family if you're having symptoms, and make sure that your mask is covering your nose and your mouth at all times.
Okay, so we'll give it a couple more minutes, see if any last minute questions come in. In the meantime, I'd like to thank Scott and Ashley for joining us today. We're really appreciative of everything Hamdard does for us as far as providing information, logging onto these sessions to help provide, information from a trusted source. There's so much stuff on the internet, Facebook said this, Twitter said that, TMZ said something else. So it's really good to get it, from a healthcare clinic. So on that note, if there's anyone that would like to make any suggestions as far as other health topics you'd like us to cover in the future, feel free to submit them in the comments or use our website or the chat feature to submit them to us so that we know what other information you're looking for. The library can provide all sorts of connections with other healthcare professionals, so we'd like to be able to provide that if there's any other health concerns we should address.
And thank you for having us as well. We love to be able to educate our local community and help out in any way possible. So thank you for providing us the opportunity.
All right. And so then in the comments, we did also have the link for the CDC website as well as the vaccine waiting list for Hamdard. We've also got the phone number for their Chicago clinic if you'd like to call and try to get get on that waiting list as well. It doesn't hurt to get on as many waiting lists as possible to kind of see which one goes first. Sometimes you expect one of them to call you back and then someone else calls, so doesn't hurt. Okay, last call for questions. If not, I think that might be it for tonight. Okay. Did you guys have a slide with your contact information in case anyone wanted to contact you directly with any lingering questions that maybe they don't want to ask on Facebook and would rather call directly?
This is the current slide that we have that shows our location as well as our contact information. So again, just to reiterate to everyone, we currently are only doing vaccinations at our Chicago clinic. We hope to updations soon, but just not currently. So as soon as we're able to do that, we will. But currently, our Chicago Devon location is at 1542 West Devon in Chicago, 60660. And we do it weekdays, Monday through Friday, from 10 a.m. to noon. So if you want to join our COVID vaccination list, again, there is the COVID vaccination link right there for you at www.hamdardcenter.org/COVID-19 meeting. Okay.
We did get one last question. Do you have any plans of holding a community vaccine event in the near future?
We hope so in the very near future. We do not have a date yet, but as soon as we have that date, we will release that to the Addison Public Library and the local community. And we would love to be able to help vaccinate our community at the Addison location. So as soon as we have more details, we will offer them.
Awesome. Thank you.
Mm-hmm.
So thank you again for joining us. And also thank you for anyone who submitted all these questions. Really helps to get, those juices flowing as far as what other questions we have.
Absolutely.
So yeah, that should be it for tonight.
Mm-hmm.
So have a good night and thank you.
Thank you guys. Have a great night. All right. Bye-bye.